During our consultation process, when someone comes in and wants to discuss a facelift and neck lift with us or any rejuvenative surgery, it's important to both Dave and I to use that time to do our best to provide you a clear, comprehensive plan that will get you to an outcome safely with the best possible result.
Also, during a consult, I'm thinking hard. I mean, like the reality is, I'm like, this is not a, oh, we'll offer X, Y, and Z. I'm thinking very carefully about what's going on underneath the hood of the person I'm talking to, and exactly what it's going to entail to get that person the best outcome that I can give. And that time is, I think, precious time to make a plan using everything that I have in my head, my experience, my knowledge, and trying to custom tailor a plan that makes the most sense for that patient. It is never, I hate the idea of it being about sales. It's not about sales. To me, this is a time for me to learn about you, your anatomy, your goals, and for a time for me to teach you about uh, the world that I live in facial aesthetics, and what you can and can't achieve, why some results look good, why some results look bad.
It's a two-way conversation. Obviously, we are thinking deeply about your anatomy and looking under the hood three-dimensionally in our minds of what's going to achieve the best result. But also during a consultation, we're getting to know you and a sense of what your risk tolerance is, downtime you can handle, what procedures or combination of procedures will work best for you, your lifestyle, your current state of health. And we tailor that plan and we take it very seriously, tailoring that plan and finding out what's going to work best, get you back to work quickest, get you ready for your red carpet event or a special event in your family quickest. And that might mean, you know, not doing certain components of a surgery or not pairing certain surgeries together or doing a more medium resurfacing to the skin versus a deep resurfacing to the skin that can be done later. But I think it's very important when we're doing a consultation, it's also learning about those components in addition to anatomy. Who's going to care for you? How are they going to care for you? Because that will influence the decision that we will help you make.
Yeah, I think, and I'm sure you have the same experience. Some consults are straightforward. Someone comes in, listen, I've been following your work. You've operated on friends, family, people in the community. I know I want to move forward. Let's just make a plan. Sure. Some people need a little bit more time to process exactly what facial aesthetic surgery is, and whether or not they feel ready to move forward. And that's also okay. Um, I think that's where the education piece comes in. But in each one of the consultations, really the goal is to make a plan that fits with your expectations, fits with your goals, and to us makes the most sense to give you the best outcome. Because again, I can't say it enough. I think we care mostly about making sure that we're set up for the best outcome possible, and that we're communicating expectations appropriately, and that we're tailoring that plan to your goals and desires.